A very good afternoon, students. This is a video on the ups paralysis or ups palsy. Okay. Now, since you have completed your class on the brachial plexus, you must have learned about the ups spine. Okay. When we see the formation of the brachial plexus, we see that it is formed by the ventral rami. Okay, and these are called as the roots of the brachial plexus. C5, C6, the ventral ramus of C5, C6, C7, C8 and T1. They take part in formation of the brachial plexus. When the C5 and C6 they unite to form the brachial plexus, okay, this is called as the root of the brachial plexus, and when they unite, this is called as the trunk. They are divided into anterior and posterior division. Now, from this trunk, there comes out the two nerves, which is called as the upper trunk, comes the two nerves, suprascapular and nerve to subclavius. So, the nerve to subclavius and suprascapular nerve, they come out from the upper trunk, which is formed by the C5 and C6 root. Thus, its root value is C5, C6, again C5 and C6. And then if you just include an area which is having the root of C5, C6, the trunk, and then the division, then this area is called as the up spine. And from this spine there comes out the suprascapular and subclavius nerve. I hope that it is clear what is up spine. Okay. Any injury to this spine, up spine, which has the root value C5, C6 with the suprascapular and subclavius nerve, that means injury to the upper trunk, will lead to a certain kind of paralysis, which is ultimately defined as ups paralysis. Okay, it is ups. Let us see if this injury is here at the up spine, and let us first discuss what are the regions for injury to the ups paralysis. Now, since this root is going from C5, C6, the trunk and the anterior and posterior division of the upper trunk, okay, during the childbirth, okay, when it is a forced delivery, that is a forced delivery, where the head is pulled by forceps, then there is a stretching between the side of the neck and the upper arm. Okay, and the shoulder and arms, they are inside the birth canal, and head has come out, and then it is pulled also. Then there is a traction or stretching of this to roots C5 and C6 at the trunk, and this may get injured. Okay, this may get injured. Any other injury by the side of the shoulder, okay, that may lead to the injury to the upper trunk C5 and C6. Okay, there may be various causes, but both most important is the injury at the time of the birth. Okay, at the time of birth. Now, when this up spine is disturbed, that is ups paralysis takes place, what are the condition of the arms, because this C5, C6 has two different kinds of the nerve supply, sensory and motor. And we see the sensory of C5, C6, the skin of the shoulder covering to the shoulder and slightly onto the lateral side, they become, sensorless. There is no sensations. Okay, so the sensation of pain, touch and temperature, what is called as exteroceptive sensation, they are not going from shoulder as well as from the upper lateral half of the arm. So this is due to the paralysis of C5, cutaneous branches of C5 and C6. Let us come to that of the muscular paralysis, when the muscles are paralyzed, which are supplied by the C5 and C6 branches, and there are so many muscles which are there supplied by the many nerves, because this C5 and C6 divisions, they will give the fiber, okay, to the various nerves, okay. And these nerves which are affected due to the C5 and C6 is supraescapular nerve and subclavius, that we already know. Then it is the musculocutaneous nerve, which is the branch from the lateral cord, that is also affected because it also contains C5 and C6 fibers. An axillary nerve, which is a branch of the posterior cord of the brachial plexus, that is also affected, again C5 and C6. And fibers of C5 and C6, they are also present in the radial nerve, and that will also be affected. So let us see what will be the condition if so many nerves are involved in this paralysis. Okay, the shoulder is here, which is, I mean to say, movements of the shoulder. You cannot perform the abduction movement, and it is just hanging by the side of the, I mean to say, trunk. So the shoulder and arm, they are hanging by the side of the arm, okay, and then arm is medially rotated, so that shoulder will show the adduction movement because it is hanging by the side, adduction movement. Arm is medially rotated because it cannot be rotated laterally, okay. So it is medially rotated. Elbow cannot be flexed, okay, and hence it will be in extended condition. So there is extension in the elbow because it cannot be flexed. The forearm is in pronated condition because it cannot be supinated, okay. So it is, so that is, the forearm is in pronated, the back of the hand, the dorsal aspect of the hand is facing forward. See here, this is the thumb I had drawn, this is the back of the hand, and it is facing forward. The fingers, so it is in pronated condition, and then you will see that the whole of the hand is in pronated condition. And in the case of the metacarpophalangeal joint, there is flexion. The fingers are flexed because they cannot be extended fingers. So fingers are flexed, okay. So you will see that the condition of the hand will be something like that, where the fingers are flexed, okay. So you are standing with that of the adduction at the shoulder, medial rotation of the arm, then at the extension at the elbow, the pronation of the forearm. So the back of the hand is facing forward, and you cannot flex extend your fingers, so they are in flex condition. This is called as policeman grip's hand, okay? Or you can be porter's stiff hands, or anything, okay? So policeman stiff hand, porter's stiff hands, okay, like that. So because this condition is like that, okay, so that hands are pronated and fingers are flex condition. Let us see why this kind of the paralysis results and involves so many muscles, okay? We will analyze it, okay? Just try to understand. Due to the paralysis of supraescapular nerve, and supraescapular nerve supplies the supraspinatus and infraspinatus. The supraspinatus is the muscle which initiates the abduction movement. The first 15 degree is because of supraspinatus. Similarly, the infraspinatus is the lateral rotator of the arm. That means it rotates the humerus laterally, okay? So there will be no abduction, so it is adducted, and there is no lateral rotation, so it is medially rotated. As I said, the arm is the medially rotated here. So this is because of the supraescapular nerve which supplies supraspinatus and infraspinatus muscle. Subscapularis, the nerve to C5 and C6 root value from the up spine, has not much effect because it is attached onto the undersurface of the clavicle, which will not have any effect onto the arm. The muscle which is having lot of effect on the nerve because it supplies many muscles is the musculocutaneous nerve, and this musculocutaneous nerve supplies the biceps brachialis and the coracobrachialis. The coracobrachialis is again adductor. I mean to say it is the medial rotator here, or it is just produces the adduction movement is there, though it is there already, it is hanging by the side. Then the muscle is that the biceps produces the flexion at the elbow joint, but since it is already paralyzed, this is hand will, I mean say the forearm is in the extended condition, okay, elbow is in the extended condition. And since the biceps is also a strong supinator muscle from pronation to supination, and supinator, this movement of supination is gone, and here the hand is in pronated condition. So this is due to paralysis of the biceps brachii, okay. And the brachialis muscle, which is also supplied by musculocutaneous, is a strong flexor of elbow. And again, as we have seen, in absence of flexion, elbow is hanging by the side and it is in the extended condition, okay. So this is a extend. You cannot flex the elbow because of the paralysis of the three muscles, okay, including that of the coracobrachialis, which is the flexor of the arm, okay, which brings the arm in front of the chest, okay, at the shoulder joint, which this movement is gone, okay. Then if you see the muscle, the nerve, axillary nerve, which is a branch from the posterior cord of the brachial plexus, it supplies the deltoid muscle. And since of its paralysis, okay, there is no lifting of the arm. You cannot abduct the arm. So the arm is, as I already said, it is in adducted condition. See here, this is shoulder is in adducted because of the paralysis of the deltoid muscle, because deltoid here is paralyzed and cannot abduct the arm, right? Then the radial nerve supplies lot of the muscles in the, I mean to say forearm, okay, it is a muscle, extensor muscles, all the muscle, extensor muscles, they are supplied, including the brachioradialis muscle, okay, and brachioradialis muscle is a flexor muscle in the mid-prone position. And as I said that there is no flexion at elbow, now it is in extended condition. So the other muscles which are supplied by the radial nerve, they are all the extensors of the wrist. So wrist is not in extended condition, I mean to say cannot be extended, okay, so it is in the flex condition. See, this is the wrist and it is flex because all these extensors from the back of forearm are gone because of the radial. So it is in extended condition but in pronated position, So the policeman tips hand is because of that. And the fingers, the long fingers, okay, their flexor is overactive because here the extensor which can produce the extension movement of the finger is gone. So only the fingers, they are here in the flex. So this will lead to this condition, okay, which is called as the Erb's paralysis. So the Erb's paralysis is an important short notes in the examination because it involves many muscles, okay, through many nerves which are branches from the brachial plexus. Though the nerve roots affected from the brachial plexus is C5 and C6. I hope that you have understood the mechanism of production of the Erb's paralysis and muscles involved for this Erb paralysis. Thank you very much for watching this video.